Why do we need to be concerned with mercury? Mercury is an immensely powerful metal.
People at the FDA really, I think, are unethical. They're sitting there and they're buying estimations by people who make money about the safety of their product. And they say, well, we don't use the precautionary principle in evaluating amalgam fillings. Why doesn't the FDA make the manufacturers of dental amalgams test and make amalgams and show that they don't release mercury, or how much mercury do they release sitting quietly?
So this is a somewhat diabolical effect of mercury, is that you want to get it out, but it gums up the whole works to get it out. And those works don't just get mercury out, they get a whole number of things out.
And what I can tell you, it's very, very high, it's very toxic, and it corresponds to what people in other countries, like the Swedes and the Norwegians and the Finns, have measured in the fecal material of people who have amalgam fillings. I mean, it goes up dramatically high with existing amalgam fillings in the person. You take those amalgam fillings out and the amount drops in their fecal material. So it's not going into them from fish. And there's all this obfuscation that comes out from the FDA and the ADA that is really just nothing more than deceiving the American public of the dangers of amalgam fillings.
Amalgams. It went to a level that would be, for the EPA, you would probably become a Superfund site. Now it slowly comes down after that, but it stays, on average, 10 times higher than someone without amalgam. So you have this conveyor belt of mercury moving down there, stopping the gate at which the mercury is supposed to come out. At the same time that the mercury is vaporizing from the amalgams, and you have 80% absorption through the lungs. So you're injecting it through the lungs, and then you close the door out. This is a fairly dangerous scenario.
Mercury or amalgam fillings were initially placed in Europe, and they came to the United States in about 1833. It was brought over by Edward and Moses Crawcour. During that time, there were hat makers who would make felt hats, and they began to have tremors, and they started going mad, and so they were called Mad Hatters, and it was well known that this was due to mercury poisoning. So during this time, the early 1800s, when the amalgam fillings came over from Europe, there were both barbershop dentists and physician dentists. The physician dentist formed the American Society of Dental Surgeons, and they formed this on an anti-mercury platform. And a few years later, the ADA formed. They defended mercury, and they felt competition from the barbershop dentists, so they were founded on a pro-mercury platform. During the mercury removal, we administer an IV of vitamin C, but prior to that, we have an enzyme test called glucose-6-phosphate dehydrogenase. That is a simple blood draw that we do, and that is required on all patients who receive an IV of vitamin C. We also offer biocompatibility testing or Clifford testing. However, all of our restorations are biocompatible. We only use zirconia crowns, and our composite material is fluoride-free, gluten-free, and it's made of organic particles. During the amalgam removal process, we always cover our instruments that will be used once the mercury is removed. We also drape the patient from head to toe. The patient swishes with activated charcoal slurry. They swish that for 30 seconds to 60 seconds and then swallow. That helps to prevent absorption of toxins. They do have their head covered. They have disposable glasses. They're on 100% medical grade oxygen under positive pressure. There's a seal around their nasal opening, so there is no mercury that seeps under their nasal mask. The staff is also in gowns along with a respirator mask. We always wear nitrile gloves because latex gloves can leak mercury. Put on one set of gloves, we rub our hands with HGX cream and then place on a second layer of gloves. The purpose of this is because HGX acts as fly paper and it binds mercury. place a rubber dam over the tooth that we're working on, which HGX is applied to the surface as well. We also place a vacuum directly under the patient's chin during the removal process, and there is an ionizer that is in the room as well. We run the ionizer 24 hours a day, but we turn it up to full capacity during the procedure. Place an isolite, which is a bite block which reflects the soft tissue away. It also illuminates the working area and suctions up any particulate and saliva and water. We also use a cleanup tip that is through the IAOMT, and we isolate the individual tooth that we're working on. We also use a very small carbide burr, and we chunk out the mercury in very large pieces with copious irrigation. Once the mercury is removed, we rinse for one minute. We also have an amalgam separator that's in the back of the building that helps to protect our environment from mercury exposure. Once we remove all of the mercury, we take radiographs to ensure that all of the mercury is removed. We remove all of the covers from the patient and from the staff, and we dispose of those in a biohazardous drum. We wipe down all surfaces with HGX wipes. Those again bind to the mercury. Once the mercury is removed from the patient and they have temporaries on their teeth, they receive acupressure and lymphatic massage from a board-certified massage therapist. This happens the day of the removal and the day after, along with the IV vitamin C. We also ensure that they follow up with their healthcare practitioner, whether that be a medical doctor, naturopath, or nurse practitioner. A few of the supplements are glutathione. This has a thiol group, which is just another way of saying it binds to mercury. You require a thiol group in order to bind to mercury. And then we also have them take IMD, or intestinal metals detox, and also a lipospheric vitamin C. Lipospheric vitamin C, lipospheric technology is very highly absorbed. It's 98% absorbed. However, you can't get the quantity of a lipospheric form as you get with an IV. That's why we have our patients, once the mercury is removed, we have them receive the IV of vitamin C as well. We have our patients take these the day of the procedure, the day before, and the day after. For more information about the amalgam removal process, please contact our office, Smile Ranch Dentistry.